In this video, we listened to Dr Morwenna Opie, clinical psychologist and POTS UK trustee, talk with Dr Boon Lim about managing your mental health when dealing with POTS. They discussed the complexities of separating mental and physical health and touch on some of the most useful strategies that can be of benefit. There is a separate video in this series with some practical examples titled Calming Down Your Nervous System.
My name's Morwenna Opie, and I'm a clinical psychologist and one of the trustees of POTS UK.
I have a question for you, Mel, which is why might people with POTS need to see a psychologist?
So, great question, and I think one that we need to approach really delicately, actually. I think it's really important to emphasize that POTS is not a mental health condition. And we know that a lot of people on their journey to getting a diagnosis have been told things are all in their head. And as a result, can perhaps feel quite resistant to being referred to see and to speak to a psychologist or a therapist. So I really want to emphasize from the beginning, really, that anyone struggling from any long-term health condition is liable to really struggle with anxiety and with their moods, for a variety of reasons, really. It's often, obviously, a big adjustment to learn to live with a condition. We're often not able to access the same activities that we used to help us feel good. We can have a lot of fears about the future, as well as difficulties. We've spoken a little bit about sleep and other things that can really compromise our well-being that go alongside a lot of health conditions.
So are you saying actually that psychology is quite helpful in dealing with some of the consequences of a chronic health condition like POTS? Or are there specific psychological techniques that are useful for the patient with the physiology of POTS? Is there something unique about POTS that lends itself well to a psychological approach?
Great question. Yes. So as I said, I think there are some commonalities with other health conditions where things like working on sleep, working on pacing, managing fatigue, relationships, all of these are really important. But I think it's more important than ever when it comes to a condition that involves the autonomic nervous system, because on top of some of those difficulties that anyone perhaps might have with experiencing difficult situations or anticipating the next day being bad, of course, what we know is that where some people might get a little boost of adrenaline thinking about these things, somebody with dysautonomia is likely to have a huge increase in those levels of anxiety. And then it can really kind of just become a vicious cycle together.
So I can understand this, and I see this in some of my patients who may even ask me, how can I tell if the palpitations that I face are due to anxiety or POTS? It's a challenging one, isn't it?
It is. And I think you absolutely can't separate them. It's a little bit like asking how much of the cake is the ingredients and how much of it is the temperature it was cooked at. Of course, kind of when those physiological symptoms show up and we have any sort of anxious response to it, it all amplifies. And I think we need to be aware that wherever we start with our baseline physiology of arousal, we've then got to think about, are we going to add kerosene to that fire and make it bigger? Or are we going to try and add water to that fire of where our nervous system is? And obviously the kerosene is a lot of those scary thoughts about what's happening to me. Is this dangerous? When is it going to stop? When am I going to get my life back? All of these, of course, amplify that. The ways that we can add water and calm things down are strategies to really bring in that parasympathetic, that calming aspect to the nervous system. And that's where things like breathing, meditation, mindfulness, techniques such as tapping, visualization, all of these things can be amazing at calming things down. And I always feel quite conscious, when people come and see me and I'm talking about strategies like breathing or like mindfulness kind of potentially being helpful, I really recognize people are often thinking, hey, lady, if you think breathing's going to help me, you have no idea what I'm experiencing. It can feel like such a small thing, can't it, to make such a big difference? But I think we need to be aware that so much of that autonomic nervous system is out of our conscious control. We can't choose to slow down our heart or reduce our blood pressure. But when we slow down our breathing, it's like the rest of our physiology listens and knows that this is interesting. If breathing slowed down, maybe there isn't a crisis. Maybe this isn't a moment of high alert. And everything kind of starts to soothe and calm down.
Good. I mean, it resonates very well. What you've said resonates with my own approach. And I guess another potentially controversial question is, if they cannot get to see a psychologist and all they're watching is this video of us speaking, what are the top tips to guide a person watching this video now from a psychological perspective, or from your perspective? How can you help patients start to do what is necessary to regulate the autonomic nervous system?
Well, I think we both really agree, don't we, on the power of breathing for calming things down. And there are some great resources out there to incorporate those skills.
Yes.
And indeed, I think that we're going to have a plan to have some guided breathing and visualization content to share as part of this program as well. But I guess I'd also emphasize that it is a really important area to get some support with. The breathing and those skills are really important. And, hopefully there's going to be some great content to access. But living with a long-term condition can be incredibly difficult. It's not unusual for people to feel very depressed and need some professional support. So I would really encourage people to speak to their GP, to self-refer for talking therapies, and to otherwise access help, knowing that it is out there. It's obviously ideal if somebody understands the condition as well. And again, we'd reference you towards the POTS UK website, where there's some information to help people and show that to their psychologist or to their GP to give them that guidance.
Thank you very much for your insights, Morena.
In summary, despite POTS not being a mental health condition, anyone struggling with a long-term health condition may face challenges with their mental health. Please seek support from your GP. Consider self-referring for talking therapies, and have an open mind. Do your research and give things a try. We appreciate that techniques like breathing and tapping may seem insignificant compared to the challenges you are facing, but we urge you to do your research and give things a try. For more information, visit www.potsuk.org.